Welcome to JNP Project YouTube channel and podcast. I'm the host, Miki Miura. I'm a family nurse practitioner in the United States. In this channel, we're going to talk about everything from how an international student can become a nurse practitioner in the United States to how to build a successful nurse practitioner career and get the life that you enjoy. I actually have a mentorship program that is coming up in July, but you can already check out the details. The website is usa.janpproject.com. Again, usa.janpproject.com. This is very exciting program specifically made for international nurses. I experienced the pains and struggle as an international nurse when I was trying to become a nurse practitioner in the United States. So this program focused on the pains and struggles that those international nurses or students would face. This is going to be all in English, so you will have a lot of opportunities to practice your English. Not only that you listen to it, but also you're gonna use your English to express your thoughts. This is very important because especially if you're in different countries right now, you don't have much opportunities to practice English. But the best way, the fastest way to practice or make your English better is actually speak it, write it. You have to do output part. So this is going to be a great opportunity for you to practice your English. Also, we're going to have a monthly Zoom call with me and your classmates. This is going to be a 6-month program, but you're going to have a monthly Zoom call that you can join and ask questions, exchange informations. Also, you're going to have, of course, online lessons, but it comes with a workbook. So you can actually have a physical workbook that you can look at it anytime. And online lessons are, you have access for a lifetime. So you can take the program now, and then you might need the information a few years later. You can go back to it and take a look. So this is going to be very exciting mentorship program. If you're interested, make sure to go to the website. Okay, so today's topic is how many years of nursing experience should you have before becoming a nurse practitioner? This is a very important topic, so let's dive in. Okay, so today's topic is how many years of nursing experience should you have before you're going to get into a nurse practitioner program? I get to, many people ask that question, and this is a very important question. So, in general, many nurse practitioner programs require at least 1 to 2 years of experience as a registered nurse or RN. Some nurse practitioner programs don't require or just recommend or don't require at all of RN experience. And a small studies show that years of RN experience before entering a nurse practitioner program range from 0 year, no experience to 38 years of experience. So it totally depends. It's even when I was in the master's program, some of us had 5 years of experience, some had 2 years, or some of us had, so it varied. But in this study, it showed that the average years of RN experience was 14 years, which is I think this study was a little bit different from what I experienced, but you will see a different people in your classroom for sure. For me, I had a total of 4 years of RN experience before I entered my nurse practitioner program. So 2 years out of 4 years, 2 years was in acute care. It was actually in Japan. I worked at a pediatric acute care department in a university hospital, and then another year, a little bit more than a year, at pediatric ICU unit at a university hospital. And then the rest of the years, 2 years, was in a primary care. I worked as a registered nurse at a clinic in Hawaii, where majority of patients are from Japan, and so I was, speaking in Japanese and English. So 2 years in acute care and 2 years in primary care for me before entering the nurse practitioner program. I continued to gain RN experience during school. So I took CPT. So I continued to work at the Japanese clinic, 20 hours per week, because with the CPT, which is like an internship program, you pay tuition, but then you get some pay from your employer, but you still have to report to the school, say, hey, how I learned this and that. So I didn't make much money from that, but it was great for my experience. I continued to do that during school. So by the time of graduation from the master's nurse practitioner program, I had a total of 6 years of RN experience by the time I became a nurse practitioner. So personally, I think you should have at least 2 to 3 years of RN experience before you are gonna get into nurse practitioner program, and preferably in acute care setting. And I'm gonna talk about why. But first of all, why 2 years, 2 to 3 years? I precept nurse practitioner students. Some of the students didn't have any nursing experience at all. Some of them are working as a nurse while they are in the nurse practitioner program. So as they are going to school, they're building their nursing experience. So that's helpful too. But I think their confidence level is low because this whole healthcare is so new to them, and they don't even have experience as a nurse. And right after graduation, you're supposed to diagnose correctly, you prescribe correctly and stuff like that. That's a big jump. So that is very stressful. Although I had a lot of excellent students who didn't have our experience before the school, but they gained nursing experience during school because they are also working as a nurse while they're going to school. So I wouldn't say we wouldn't work at all, but it would be harder because it's going to be a huge jump from your non-medical, non-healthcare person to you're supposed to be expert. Especially, nowadays, most of the nurse practitioner students go to DNP program, the Doctorate of Nursing Practice program. So you're supposed to be a doctor. There's no higher degree than doctorate degree. So you're supposed to be a doctor, but you're kind of novice. You're like, you don't have experience, and that's a lot of pressure. If you decide to go into nurse practitioner program without previous RN experience, definitely you should work as a nurse while you're in school too, so you can have some RN experience while you're in school. But I think it will be better to have, especially if you're an international student, definitely recommend to have RN experience, if possible, in your country, because in your country, you understand language. So there's no language barrier. So you can just focus on learning nursing. And then in English, you can learn after you come to United States. It's gonna, don't worry about it. It's gonna come to you. My English wasn't, it's not even that good right now, but it wasn't this good back then, but it's gonna come to you. Don't worry about that. Because you're gonna be forced to learn English when you're in school or when you're working. But initially you want to focus on nursing, and good thing about nursing is we humans have pretty much the same body. So even if you don't understand English, vital signs like blood pressure, the numbers are the same. If the O2 saturation is 70%, even if you don't understand English, that's not good. The person will look blue and stuff like that. It's not good. Even if you don't understand English. So very important to have basic nursing experience, training or experience without language barriers. I think I would recommend to have your RN experience in your own country before getting into nurse practitioner program, unless you are English natives. Yeah, and then the year's experience, if possible, preferably it should be in a critical care like ICU or even ER, because I had the pediatric ICU experience. Also, I worked in acute care nurse, acute setting like the pediatric pediatric unit at a university hospital. Through that experience, I learned what could happen when people became really critically ill and what has to be done. So I always have a little bit of thinking that if I miss this, if I miss something, or if anything, this could happen, So I have an exact image of the worst case scenario. So I have a little bit more sense of fear, but in a good sense, that I'm not going to be like, oh, that's nothing, don't worry about, oh, you have a breast lump, it's nothing, that's okay. It could be nothing. I mean, fear is not always good, but it could be nothing, but it could be something that you can't, like, how can you tell? Like, if you just feel it, and can you tell that it is nothing without doing imaging and mammogram and ultrasound? Or if you miss something, it could be this. So I think that was helpful for me to know that the spectrum of illness, that the ICU and ER is the worst case scenario. So looking at the whole spectrum was really helpful. And even if you end up becoming a family nurse practitioner or primary care nurse practitioner like me, and usually we just deal with the patient who are not that ill, because when they become super ill, they go to we send them to hospital. But you always want to have the image of what will happen at a hospital, and then especially after they get discharged from the hospital, we have to have an image of what was done there. So I think it's really important to have acute care experience. And I feel like through working at a acute care, I kind of developed some kind of sixth sense feeling that it's like, this one, like I had a patient one time that she came in for a checkup, and I checked her breast, and I felt a lump, and I felt a bad feeling that, I can't let it go. Let's just check it and see. I didn't know it's definitely a cancer, but I just felt like this is something that I shouldn't just let it pass. Let's just make sure. And then sure enough, it was, breast cancer. So I feel like through that acute care experience, I developed some kind of sixth sense, and it's just like, I don't know. And it helped me from so many possible mistakes or malpractice, but I didn't have the malpractice cases because I felt like I have to listen to my instinct that something is wrong, Also, working as a registered nurse helped me. This is not even only at the acute care, but also at the primary care. Working as a registered nurse really helped me to understand the dynamic of team care. Because once you become a nurse practitioner, you're going to be a leader of the team, the healthcare team. But you need to understand the role of receptionists, role of clerks, role of your medical assistants, and roles of nurses. And it was good for me to understand what people are good at and what people are, their roles are, and how to communicate with them. So that was very helpful. I wouldn't recommend, like I said, there's pros and cons. I've had students who are excellent and didn't have RN experience at all before the program. But you can still become an excellent nurse practitioner, but I think it would be hard. I had a student too who didn't have RN experience before and also didn't work as an RN throughout nurse practitioner program. She did have a little difficulty of communicating with patients because people may not agree because I don't look like it, but I'm actually shy. But at work, as a nurse, we're trained how to communicate with strangers. We have to quickly build a good relationship with a patient and their family. So we have the skill. So at work, I'm not shy because I'm a professional. I got trained over many years, actually 15 years working as a nurse and nurse practitioner. So if you consider my initial bachelor's degree, like almost 20 years of being trained for this. So obviously I know how to do things. And communication is something that I learned through nursing school and nursing experience as a nurse practitioner. But if you don't have too much training, even if you graduate from nurse practitioner program and become a nurse practitioner, if you don't know how to communicate with patients, that'll be hard. Because one of the best thing about nurse practitioners are we're so good at communicating with patients. Oftentimes patients say, you guys listen. Nursing, one of the strengths of nursing is we listen. We actually listen to patient. We actually listen to patient, what they're saying, what they're feeling, because we value their input. They know their body really well. If something is different, something must be different because they know. And we actually listen, we value their opinion. And that's why patients trust us. But if we don't have the communication skill, we wouldn't understand what they're thinking. So we couldn't provide a good care. So I think we need to have nursing experience before you become a nurse practitioner. Some advice especially for international students with F1 visa, which is a student visa. I would highly recommend to have RN a nurse experience in their own country, so you don't have a language barrier, but you can focus on nursing. And then unless they are English natives, then when you come to United States, you can work as an RN in the United States in English. But at least you can have first step working without language barrier. Also, when you come to United States, it might be hard for you to find RN job or nursing job right away. So that's another reason too. I think primary care experience will be very valuable, and I'm going to talk about that in depth in the next video. But we'll talk about, whether you should have acute. So I'm so glad that I had both experience. I worked in an acute care setting, but also in a primary care setting. And primary care experience is very helpful for me because I work in a primary care setting as a family nurse practitioner. And the primary care is so different from acute care. It's not like one is better than the other. It's just different. How we take care of people are different. So ideally, if you have both experience, that would be even better. You should try to use CPT during the nurse practitioner program to gain your nursing experience, especially in the United States, because how things are done depends on the country. You can also enter BSN to RN to BSN program, which is what I did. So I had a first bachelor degree in nursing from Japan, worked as a nurse in Japan, then it came to United States, and I transferred some of the credits from the bachelor program from Japan to University in Hawaii in United States. And then I got my second bachelor degree because I wanted to improve my medical English before I enter nurse practitioner program. Also, I wanted to learn nursing in America, which I'm so glad that I did. And by the way, at the group mentorship program, we're going to talk about this. We're going to talk about how to improve your medical English. Also, you're going to learn American nursing. It's so different. There's so many things that are different. So we're going to go over that. But I'm glad I got to learn those things by going to a second bachelor program. After I finished that program, I had 1 year of OPT, which is a temporal work permit, and I worked at the outpatient facility. Then I entered nurse practitioner program, which was 2 years, master's degree. Throughout that, I was using CPT and working 20 hours per week as an internship at the Japanese clinic. And then after I finished the nurse practitioner program, I had another year of OPT, and I was working as a new grad nurse practitioner at private OB/GYN office. And I got a permanent residency green card through the job. So there, as international students, there are still multiple opportunities to gain your nursing experience, and you should take every little. It's going to be hard to balance work and school, but work experience is so helpful. You might not get much money, but you know what? The experience is everything for nursing. So you should take any opportunities that you can gain experience, but also you build connections within the community, and especially small communities like Hawaii. You need to know people to gain opportunities or job opportunities. So that's really important too. Okay, so yeah. In the next episode, we're going to talk about more about, working in primary care as a nurse, whether it's wasteful or not. But in this episode, we talk about how many years of nursing experience you should get. I would say at least 2 to 3 years and preferably in acute care is better. And if you're international students, I would recommend to gain your first nursing experience in your own country without the language barrier for a few years and come to United States and have some more experience. I know it's going to take a little while to become an actual nurse practitioner in the United States, but those experiences are so valuable, so helpful. So it's not a waste of time, and it's going to be really helpful. All right. So that's today's video or episode. I will see you in the next episode. Take care. Aloha.